Welcome to the SIM Stakeholder webinar. Before we get started, I'd like to go through a couple of GoToWebinar housekeeping items for the Q&A session at the end. Right now, all participants are on mute. At the end, you will be given the opportunity to ask questions, and you can do so through either the chat feature by typing your question, or if you would like, you can raise your hand and I will unmute you. You'll notice in the GoToWebinar control panel, there's the option on the right-hand side of that bar. You can log in with your telephone and the phone numbers at the bottom, or your computer's microphone and speakers. And as a reminder, the webinar will be recorded and available on both the SIM website and the YouTube channel. Now I'm going to pass over to the SIM team.
Emma, will you hit the next slide for me, please?
Yes.
Thank you. Oh, next one. Good morning, everyone. This is Catherine Blair, Governor's Senior Health Policy Advisor, and I am one of the members of the SIM management team, and excited to get to kick this off today. For those of you that have been engaged in the SIM work with us since the beginning, you'll know that we have actually been working on this project for almost 2 years now. The very first SIM FOA came out in August of 2012. So thank you for your patience and your commitment to making Colorado healthier and focusing on this work to integrate behavioral health and primary care with us. I'm very excited to be hosting this webinar today because this represents kind of the kicking off of our next phase of the SIM work. As you know, we received a planning grant last year and engaged many stakeholders in that planning work that led to the State Health Innovation Plan. And just 2 weeks ago now, the feds opened up a new funding opportunity announcement, or FOA, providing states the opportunity to apply for funding ranging from $20 to $100 million over a multi-year period to really phase in their state innovation model work. I'm also very excited to announce that we at the Governor's Office have hired Vatsala Pathy to coordinate our work and be our project director for SIM, particularly in this phase while we're ramping up and writing the grant application. So at this time, I really just want to thank you all for making the time to do this today, especially on fairly short notice. We will be asking a lot of things on fairly short notice over the next couple of weeks as we prepare this grant application. But now I will turn it over to Vatsala, who is going to walk us through the rest of the webinar. Vatsala.
Could you move to the next slide, Emma? Next slide, please. So I'm going to spend a few minutes talking about both where we've been and where we're going. And probably the most important part of this webinar is an opportunity for all of you to ask questions and be heard. This is the beginning of a whole communications process that I'm going to talk in more detail about later. But we value your input and your commitment to this work. So next slide, please. So really, the building blocks of SIM have been in place for a really long time. As this slide shows, it's you know, the governor has a plan that you know, focuses on improving health in Colorado. The work that many of you did with the 208 Commission. There's a lot of work being done in public health agencies across the state. And all the work of the past 2 years that Catherine referenced, that all of you have been involved in helping to shape what is going to go into the proposal that we submit to the federal government. Next slide, please. So our vision and goals for this project, they are to create a coordinated, accountable system of care that gives Coloradans access to integrated primary care and behavioral health in whichever setting counts as the patient's medical home. We are aiming to leverage the power of our public health system to achieve broader population health goals and support delivery of care, and to use outcomes-based payments to enable that transformation. And we also are very committed to engaging individuals in their care. So those are kind of at the very high level, the goals of this project. Next slide, please. Some of you may be wondering what we mean by integrated care, or how we're approaching this question. And this slide offers you a definition that has been used by the SIM management team over the course of the past few years, that kind of summarizes our definition, or the approach that we're taking to integrated care. Next slide, please. Could you click? Okay. Why does this matter? Because 84% of the time, the 14 most common physical complaints have no identifiable organic etiology. 80% of people with a behavioral health disorder will visit a primary care doctor at least one time in a calendar year, and 50% of all behavioral health disorders are treated in the primary care setting. So this is a big issue, and something that we're all seeing in the clinical setting, and is manifested in health outcomes at the population level, and it's something that that bears addressing. Next slide, please. So you might be wondering who's on the SIM management team. I was recently brought on to this project, but there have been many other agencies and organizations in our state that have been involved in the management of this project to date. The Governor's Office, the Department of Healthcare Policy and Financing, the Department of Human Services, the Department of Public Health and Environment, as well as the Colorado Health Institute, the University of Colorado School of Medicine, and the Center for Improving Value in Healthcare. But I would like to reiterate that while the SIM management team has been doing a lot of the legwork, none of this is possible or without the input of all of the stakeholders in the community, and we have a strong commitment to making sure that all of you continue to have a voice at this table. Next slide, please. Emma, next slide. Thank you. So here are a few tactical issues related to the FOA. The FOA is, the deadline for the submission is the 21st of July. So we basically have a 6-week, since it was dropped, a 6-week turnaround for submitting our proposal. We're going to try to ramp up our communications with all of you by doing a couple of things. We'll be sending out weekly updates on our progress, and we will also be building upon our existing communications to strengthen ongoing outreach. And as I'll talk about later, there are different folks on the management team that are responsible for writing different parts of the FOA, and they've been reaching out to key folks in the community. And if any of you at any point have questions or concerns, I am here and available, so don't hesitate to be in touch. There's a SIM email address that's in this slide deck that you can use, and I will be getting those emails and can respond to you that way. We also plan on, after the submission of the FOA, to continue to strengthen the stakeholder engagement by developing a plan that helps to make sure that all of you are a part and partner at the table moving forward. Next slide, please. Next slide. So where we've been, Colorado received a $2 million pre-testing award from CMS, and there were a number of stakeholder work groups that were involved in the development of the original proposal. In December 2013, a healthcare innovation plan was submitted to the federal government as part of the pre-testing award. Since that time, the SIM management team has been waiting to hear about the next round of funding, and as Catherine mentioned earlier, we now have that access to that now. Next slide, please. So here are some important dates, and as well as a link to the actual FOA if you're interested in reading the document. The letter of intent is due tomorrow, but has already been submitted. The submission deadline is the 21st. The award notification is at the end of October of this year, and the grant period begins in January of 2015 and goes through the end of 2018 with a one-year ramp-up period. And that one-year ramp-up period is going to be very important for us to engage and re-engage with all the key folks that are going to be involved in this project moving forward. Next slide, please. So what does CMS want in our response to the FOA? They want a delivery system reform plan that includes non-fee-for-service payments, multi-payer participation, and explicit commitments from payers and providers. They're also interested in exploring policy and regulatory levers at the state level and how the health information technology infrastructure interfaces to support and augment the work around delivery system transformation. The FOA also has some very specific population health targets that it's interested in trying to achieve. And as part of achieving that, they're also interested in a population health plan. And they're also interested in how this project will align with other work that's related to this, both at the state level and at the federal level. So those are kind of the core narrative components of the FOA. Next slide, please. They also want a very tactical description of how that narrative plan is going to be executed, as well as letters of commitment and support. And I know that some of you have already heard from folks on the SIM management team as it relates to those letters of commitment. They also want a detailed financial analysis and a budget, and cost targets and quality targets. They want a detailed assessment of performance metrics over the course of the grant period. They are also very interested in monitoring and evaluation and the sustainability of the project beyond 2018. So those are the core components of the proposal that we're pulling together at the present time. Next slide, please. So prior to the submission deadline, there are a few ways in which you all can get engaged and have your voice heard. Tomorrow on the Colorado SIM website, we will be posting some forms, a response form along with some narratives that describe all of the key sections of the proposal. And we welcome your input and feedback to us based on the questionnaire that we've provided on the website. So we encourage you to go tomorrow to the website and give us your feedback. The SIM management team is also going to have a draft proposal completed by 6/27 toward the end of this month, and our goal is to have that distributed to all interested stakeholders for your reading pleasure. And then we're going to have another webinar similar to this on the 2nd of July for further questions. And between now and then, we're going to be asking for what the feds call attestation letters or letters of support from key partners in this project. After the rush of getting this proposal together, we remain committed to getting your honest, feedback as we hone our communications and outreach, and want you all to feel that we are accessible to you, and that you're partners in the implementation of this project moving forward. Next slide, please. Next slide. So, you know, it's maybe stating the obvious, but there are a lot of stakeholders that are both interested and vested in this work. And while many of you have been involved in our process, what we've heard is that you'd like more information, transparency, and clarity about how decisions are made. And it's our commitment to do that moving forward to the best abilities that we have. So at this point, next slide, Emma, please. I would like to open it up to questions, and we have other members of the SIM management team here with us, so if I can't answer them, others can. Emma, do you want to go over the instructions again on how to how people ask questions?
Sure. You can either ask the question through the questions chat feature on your GoToWebinar control panel, and I can read it to the SIM management team and then they will answer. Or you can raise your hand, which is a little icon on the GoToWebinar control panel, and I'll unmute you. And you can speak directly to all participants and the SIM management team. So if we're ready, the first question is if the letter of intent will be made publicly available.
Will the letter of intent be made publicly available? Yes, it will.
Yeah, it's completed and was submitted, I think, yesterday. So yeah, we will post it on the site. It is a federal form letter, so it's not particularly exciting, but it will be made publicly available.
We're going to be trying to post as much as we can on the SIM website so that folks can access documents easily in one central place, and we'll put that on the website. It just went out yesterday afternoon.
Yeah, and as was said, it is a form letter. The intent for the letters of intent is for CMS to get a head count on how many applications they can expect to need to review.
The next question is, I would love to know what the feedback from CMS was. What do we need to change so we can be successful this round?
So I think there are a couple of key areas that the feds kind of focused their feedback on. And I should say that we've now been through two fairly iterative processes with the feds, CMS, around this. First on our initial application, and then second on our state health innovation plan. I think that the feedback generally that we addressed last year was how do we better integrate public health into the picture of doing integrated behavioral health and primary care, and what is public health's contribution to the system. Also, what is the role of commercial payers in this? And so, you know, as we look to build this next application, we have looked at those and addressed those, and a lot of the work that we did last year really laid the groundwork. I'm going to kind of phone a friend and see if there are other areas that bubble to the top for folks.
After the pre-testing round, the CMS did contract with an evaluator to look at all of the submissions, and they gave us the Colorado piece of that evaluation, and I think we can post that to the state SIM website.
The next question is, what ideas are there for responding to CMS's requirements of a non-fee-for-service model?
I'm sorry, could you repeat the question, Emma?
Yeah. What ideas are there for responding to CMS's requirement of a non-fee-for-service model?
So in the innovation plan that we submitted last year, there was a trajectory for payment to support the integrated care model, starting with fee-for-service plus a PMPM care coordination payment, then moving to shared savings opportunities with a goal of, over the course of the grant period, moving as many practices as possible to a place where they are capable of accepting prospective payment for the integrated primary care and behavioral health. So that is the focus of the conversations we've been having with both practices and payers about moving away from fee-for-service.
For the SIM management team, would you mind identifying yourself as you're speaking? We've had a few requests for that.
Sure, that was Edie's son who just made that last comment, but we will do that moving forward.
And also speaking prior about some of the technical issues from CMS was Leah Spielberg, who's the grants manager at HCPF, and will kind of be overseeing some of the more technical side of our grant submission. And this is Catherine Blair from the governor's office.
Thank you. Next question is, behavioral health services are lacking within our state, particularly to vulnerable populations, many of which have Medicaid. Will there be efforts to reach out and integrate existing behavioral health centers?
Yeah, absolutely. So I think there's a couple components to that. So I think the first is assessing or using current assessment of kind of what the shortages are in behavioral health and developing a plan to address those shortages, both in the short and long term. But I think that the real key there is identifying shortage of what particular behavioral health providers and in what communities. So that's part of the SIM work, but it's also part of the work that we are doing through an NGA, National Governors Association Policy Academy focused on health workforce, and behavioral health is one of our components there. Secondarily, yes, there will be, SIM offers the opportunity to make investments in targeted areas to help support the infrastructure that delivers integrated person-centered care, whether that's in a medical primary care setting or in community mental health centers.
And that was Catherine Blair speaking.
Sorry.
Our next few questions are people who will be speaking to you all. So Brian Stanley, I'm going to unmute you for your question. And you can go ahead now.
Okay, can you hear me okay?
Yes.
Yeah.
Okay, good. Yes, this is actually just to that very last point. I am a behavioral health care provider. We've been working with HCPF in the last few years, and then recently with the RICOs and the new payers and the BHOs. And we're working quite a bit with the RICOs on trying to do just what the last question was, and that is to help bring our particular kind of service, which is outpatient treatment in the behavioral health care area. So that to us is substance use disorder and mental health. And we've developed a number of technologies or proposals for technologies in addition to communication systems that's aimed at, and we're just in the early stages of this before this grant even popped onto my horizon, of being able to integrate those providers who can provide that service into, right now, what we're working with is the RICOs, but there's no proprietary thing there, where any provider in the state who wants to get involved in what we'll just call a network of outpatient substance abuse and mental health providers such as ourselves, and there are about 300 in Colorado with about 500 locations, integrate those together. And the reason I shouldn't say integrate, but interconnect those. And the reason why the SIM grant caught my attention was that we're working on trying to do that just as a matter of our response to the industry and where we see the Affordable Care Act funding going. And I'm just looking at this grant to see if there's some way that our designs or our technology or our, the concepts can participate in this. But having said that, I know absolutely nothing about the process you guys have just described.
And I'm so, I didn't catch your name, but this is Vatsalapathy. I'd be more than happy to speak to you offline and get your thoughts on what you're doing and just figure out what synergies there might be with the SIM project. So perhaps you can contact me through the SIM email address.
Okay, and that so I'm looking at the email addresses. I've got Emma's that came in from the webinar notification. Are you in that somewhere?
You know what? You can contact Emma, and she will forward it to me.
Okay, thank you.
Brian, this is Catherine. I think what you brought up brings a really good point, which is more of a core value of the SIM work is to build on existing work that's already being done in Colorado, and that's happening on a variety of fronts. So I really see it as, we have a lot of balloons floating out there, but what SIM is going to try to do is to tie them into a nice organized bunch so you can take them to the party, right? So, I'm not familiar with the details of the work that you're doing, but it certainly sounds synergistic with what we're trying to do. The RICOs are a huge partner in this. I'm not sure how much you've worked with each of the 7 RICOs, but they all operate a little bit differently on some fronts, and so making sure that we have a consistent message and framework that we're able to deploy and engage communities and regions statewide is really the objective of this. So we'd be happy for you to be a balloon in our bunch.
Oh, and I'm sorry, Brian, I just muted you. There was some feedback. I'll unmute you now if you have a little response.
Okay, so just to respond to that real quickly, and then I'll follow up with a note to Emma and let you guys reconnect with me. But that's exactly our intention. The RICOs we're dealing with are 2, 3, 5, and 6. We're in the Denver metro area, but there's absolutely nothing about that regionally that can't be done on a broader scale. The software and the technology that they're working with is cloud-based, so it's not some kind of, location-dependent piece, which I think will be very important to enable what you're just talking about.
Thank you so much, and I look forward to reconnecting with you later. Emma, who's next?
So next, Shelley Spalding, I'm going to unmute you. And just to prevent feedback, I'm going to mute you as soon as you're done with your question, but then unmute you after the SIM management team response. So go ahead. Okay, Shelley, I'm going to guess that you raised your hand accidentally. If you have another question, please raise your hand again. So the next person on the line is Betty Encino. I'm going to unmute you, and you can go ahead.
Hi.
Hello.
CJ?
You can go ahead and ask your question. Okay.
Do you have a question?
So we're going to mute her again. And so if you have any questions, just raise your little hand icon. We have some more questions in the comment boxes.
Okay. Why don't you go ahead and read it out loud, Emma?
Yep. As the next proposal is developed, how will the proposal team engage and secure information from community providers outside of the Denver metro area? And this is Pam Jones on behalf of the University of Colorado, Colorado Springs Health Circle.
This is Edie Sun from Civic. In fact, we were just talking this morning about ongoing stakeholder outreach after the time the proposal is submitted, and I think that's what this question is about. As thinking about once we received the cooperative agreement and we're able to actually implement the SIM plan here. A big piece of it, of course, is going to be ensuring that we are implementing the model outside of the I-25 corridor in metropolitan areas. So we have been having conversations with both payers operating in non-metropolitan parts of the state, and as well as provider groups. And we will be reaching out to community organizations as part of that, certainly local public community partners throughout the state that will be critical to the success of this going forward. So hopefully that answers the question.
Thank you. The next question is, has there been any discussion on utilizing telehealth as an alternative solution to access issues?
Yeah, this is Catherine. I'm excited about that. So yeah, we have a whole health IT component to this, and it's a portion of the plan, and I think it's a total of 4 pages out of 29 of what we have to submit to the feds. And so telehealth is definitely a component to that. Policy and financing is also working on some complementary telehealth work. So again, that's another balloon in the bunch. And the point person for our health IT work is Kate Kiefert, who is the governor's health information implementation coordinator and a part of the management team, although she's not here with us today.
And this is Edie, if I can just chime in on that. Certainly as we think about how to implement the integrated care model in non-metropolitan areas, telehealth is a key piece of that. And so partners like the Colorado Telehealth Network will be essential to the success going forward.
Thank you. The next question is, when looking at workforce and service shortage, will you be distinguishing between care for children and care for adults?
This is Catherine. So yeah, I think we have a number of what I will term special populations for right now. When we look at the total composition of the Colorado population, recognizing that there are large groups who either seek care differently or have a different type of care that is needed than kind of the average population. I think pediatric populations are hugely important in that. Particularly because Colorado has had such a strong history with advancing primary care medical homes with family physicians and pediatricians and other family practitioners. So yes, there's a huge component there that we haven't quite worked out yet, but we are working with some partners to identify what the key needs and strategies should be in that area.
The next question is regarding the payer work group, and they're specifically asking if there's been any commitments made to support payment reform trajectory described in the plan, like paying for integrated care and aligning metrics.
So this is Edie's son. We've had conversations with all of the key payers in the state of Colorado, and those conversations are ongoing. And our goal is to get letters of commitment from as many of those payers as possible. And they've been very constructive discussions with the payers so far. Catherine had mentioned earlier that one of the things we want to do is build on work that's already happening in the state, and so from the payer perspective, the key is that our model is designed, our model for payment is designed to build on what commercial health plans are already doing through the Comprehensive Primary Care Initiative. Which is providing a care coordination payment to primary care practices with an opportunity for shared savings as that initiative moves along. So we're trying to sync up our approach with what practices are already doing in the context of CPC, and also build our measurement expectations so that they align with those CPC measurement expectations as well. So those are some of the things we're talking with the payers about.
Thank you. The next question is, how is the work that was done in the small groups earlier this year being integrated?
Emma, do you have another question?
I do. How is the work that was done in the small groups earlier this year being integrated? This question is specifically regarding the public health and population health work.
Yeah, so I'm hoping that whoever asked the question was part of the public health group last year, but we did develop a number of work groups that met last summer to really inform the state health innovation plan, and the content for that was then kind of fed into the SHIP, as we call it, as the SHIP was finalized late last fall and submitted to the feds in December. since we began that process with the work groups, we've had some significant turnover at CDPHE, including the executive director, as well as the director of Prevention Services Division, who is now Dr. Liz Whitley. And so Liz Whitley serves on our management team now and has been looking at the work that was done last summer and the fall, and working with some of her other colleagues at CDPHE to kind of form together a plan. But if your particular interest is in public health, I'd be happy to connect you with her and some of the thinking that she's doing. My instinct and what I know about it is that it's going to build from the work that was done last summer and build from the SHIP, but it might look a little bit different. I know there's a huge component in there for local public health agencies, but I don't have the precise details right at the moment.
And this is Vatsla. I just add that in addition to Dr. Whitley, Gabriel Kaplan has also been sitting in on our SIM management team. So both of them are resources around the public health work.
The next question is, if we convert to a prospective payment model for providers interested in providing integrated care, will the payment travel through the BHO capitation or via another route?
So this is Edie, and a couple of responses to that. First of all, prospective payment is the ultimate goal. It's not something that's going to happen overnight. And bear in mind that there are pretty specific consumer protections built into Colorado statutes to ensure that any provider organization that is accepting risk in the form of a prospective payment has the financial resources to enable them to manage that risk. In the commercial sector, the behavioral health organizations that work with Medicaid don't play a direct role there. The commercial payers have their own behavioral health units, and so in our conversations with the commercial health plans, we're talking about how to get them to have their physical health and behavioral health units working together on on benefit administration and claims payment within this model. In the Medicaid sector, Catherine, do you want to talk a little bit about how that would work with BHOs, or do we have
that we've addressed that yet? You know, since the FOA came out a couple of weeks ago, we've been having a lot of conversations about how we're going to do work and how we're going to engage people, but a lot of the content is still in development. So absolutely can flag that as something to put on our list of things to be sure to communicate back out once we've kind of brought all the partners to the table and had that conversation, made that decision. But at this point, I don't think that there is a specific direction on that.
Next question. As a treatment provider, we're finding that we're beginning to have trouble communicating with BHOs and payers because their secure email system do not allow us to initiate an email with them. We can reply within their system, but not originate an email. Who can we discuss a solution with? This is an important HIPAA compliance.
So that's a really good question, and maybe one that's this is maybe going to sound a little bit like my last response, and I apologize, it's Catherine. You know, I think where we are with the SIM work right now, particularly on really operational pieces, particular to the HIT front, is to set a vision and establish a work plan that'll get us to that vision. The vision for HIT is you know, fully interoperable systems so that providers can communicate either on the behavioral health side or the physical health side with each other when they're you know, within the bounds of HIPAA and 42 CFR and everything else that help improve patient care. But I'm afraid I don't have a really specific answer for that right now, other than if it's a current problem, I would hope that your current BHO is aware of it. But I can flag that for Kate and have her follow up if you can let me know who that was, Emma.
Well, it would actually be very helpful. This is Edie. It would be very helpful if that concern could just be emailed into the SIM website so that we can flag that as one of the potential barriers we need to address in order to implement the model.
Great. Next question is, will there be inclusion of alternative care models such as nurse practitioner-led integrated primary care?
So this is Edie, and the answer to that is yes, absolutely.
Great. So those are all the questions that have come through. We can stay on for just a few more minutes to see if anyone has any additional questions.
This is Leah. If there are no more questions now, you can always submit questions through the SIM website. We check it every day.
And just to clarify, it's the SIM. There's a SIM email address, and it's on one of the. That's actually this one is incorrect, but it's at the beginning of the slide deck. We'll make this correction before this slide deck goes up onto the Colorado SIM website. But there is at the very beginning of this presentation, there was a email address that is the inbox for all of our input that we can get via email. So don't hesitate. There you go. It's this is the email address. So and we will also be sending out weekly updates, and so that'll be another way for you to hear about what's happening. Emma, are there any more questions?
There is not. And just a reminder for folks that the webinar has been recorded and will also be posted to the SIM website.
Okay, great. Thank you so much, and we'll look forward to being in contact with you over the coming weeks and months. Have a great day.